Migraines are not just ordinary headaches, they are a complex neurological condition that can cause intense, debilitating pain. This pain usually occurs on one side of the head, though it can affect both. Migraines are often accompanied by other symptoms like nausea, vomiting, and sensitivity to light and sound. Imagine a throbbing, pulsating pain that makes it impossible to concentrate. This is the reality for millions of people who suffer from migraines. The pain can be so severe that it disrupts daily life, making it difficult to work, study, or even enjoy simple pleasures. Migraines are more than just a headache, they are a collection of neurological symptoms. These symptoms can vary from person to person. Some individuals may experience migraines frequently, while others may only have them occasionally. Understanding migraines is the first step towards effective management. By learning about the different types, symptoms, triggers, and treatment options, individuals can take control of their health and find relief from the debilitating effects of this condition. Migraines are not one-size-fits-all. They manifest in different ways, and understanding these variations is crucial for accurate diagnosis and treatment. Two of the most common types are migraines with aura and migraines without aura. Migraines with aura, also known as classic migraines, involve sensory disturbances that precede or accompany the headache. These disturbances, known as auras, can include visual phenomena like flashing lights, blind spots, or zigzag patterns. On the other hand, migraines without aura, also called common migraines, occur without these sensory warning signs. The headache itself is often the first noticeable symptom. While less dramatic in their onset, they can be equally debilitating. Other less common types include hemiplegic migraine, which mimics the symptoms of a stroke, and menstrual migraine, which is closely linked to hormonal fluctuations during a woman's menstrual cycle. Understanding these distinctions is vital for tailoring treatment plans. Migraines are like chameleons, often mimicking other conditions, which can make diagnosis challenging. Recognizing the distinct symptoms of a migraine is crucial for seeking appropriate medical attention. While the hallmark symptom is an intense, throbbing headache, often on one side of the head, migraines rarely appear alone. Nausea and vomiting are frequent companions of a migraine attack. The intense pain can disrupt the digestive system, leading to these unpleasant symptoms. Sensitivity to light, known as photophobia, and sound, known as phonophobia, are also common, making everyday environments feel unbearable. Other symptoms can include dizziness, blurred vision, difficulty concentrating, and even neck stiffness. Recognizing these symptoms early on can be helpful in managing the migraine effectively. Early intervention with medication and lifestyle modifications can often shorten the duration and severity of the migraine attack. A migraine attack is not a single event, but rather a process that unfolds in stages. Understanding these stages can empower individuals to manage their symptoms more effectively. There are 4 distinct phases: prodrome, aura, attack, and postdrome. The prodrome phase acts as a warning signal, occurring hours or even days before the actual headache. During this phase, individuals may experience subtle changes like food cravings, mood swings, increased thirst, or frequent yawning. The aura phase, experienced by some, involves sensory disturbances like visual hallucinations, tingling sensations, or speech difficulties. This phase immediately precedes the headache. The attack phase is the most debilitating, marked by intense head pain, nausea, and sensitivity to light and sound. Finally, the postdrome phase, also known as the migraine hangover, is a period of recovery after the headache subsides. During this phase, individuals may experience fatigue, muscle weakness, or difficulty concentrating. Section 5. Risk factors. Who is more prone to migraines? While migraines can affect anyone, certain factors can increase the likelihood of experiencing these debilitating headaches. Understanding these risk factors can be helpful in identifying individuals who may benefit from preventive measures and early intervention. Family history plays a significant role in migraine susceptibility. If a close relative suffers from migraines, the chances of developing them increase significantly. Gender is another crucial factor, with women being 3 times more likely than men to experience migraines. Hormonal fluctuations, particularly during menstruation, pregnancy, and menopause, can trigger migraines in women. Other risk factors include age, with migraines typically starting in adolescence or early adulthood, and stress, which can trigger and exacerbate migraines. Certain lifestyle factors, such as lack of sleep, irregular meal patterns, and caffeine withdrawal, can also increase migraine susceptibility. Understanding these risk factors can empower individuals to make informed lifestyle choices that may reduce their risk of experiencing migraines. Section 6. Triggering the storm, common migraine triggers. Migraines are often triggered by specific stimuli, and identifying these triggers is crucial for managing the condition effectively. While triggers can vary from person to person, some common culprits include stress, certain foods, and environmental factors. Stress is a well-known migraine trigger. The demands of modern life, both personal and professional, can take a toll on our nervous systems, making us more susceptible to migraines. Learning stress management techniques like meditation, deep breathing exercises, or yoga can be beneficial. Certain foods and beverages can also trigger migraines in susceptible individuals. Common culprits include aged cheeses, processed meats, chocolate, red wine, and foods containing artificial sweeteners. Keeping a food diary can help identify personal dietary triggers. Environmental factors like bright lights, strong odors, loud noises, and changes in weather patterns can also provoke migraines. Being aware of these triggers and taking steps to avoid or minimize exposure can be helpful in managing migraines. Section 7. Diagnosis. Unraveling the mystery of migraines. Diagnosing migraines can be challenging as there is no single test. Doctors rely on a combination of medical history, physical examination, and ruling out other conditions to make an accurate diagnosis. The first step is a detailed discussion of the patient's symptoms. The doctor will inquire about the frequency, duration, and severity of headaches, as well as any accompanying symptoms. A thorough neurological examination will be conducted to assess vision, coordination, reflexes, and sensory perception. This helps rule out other neurological disorders. In some cases, imaging tests like MRI or CT scans may be ordered to rule out other conditions that can mimic migraine symptoms such as tumors or aneurysms. Keeping a headache diary, noting down the frequency, duration, and potential triggers of headaches can be incredibly helpful for diagnosis. This diary provides valuable information to the doctor, aiding in accurate diagnosis and treatment planning. Remember, early and accurate diagnosis is crucial for effective migraine management and improving quality of life. Section 8. Migraines and women. A complex relationship. Migraines are more prevalent in women than men, and this disparity is often attributed to the complex interplay between female hormones and brain chemistry. Fluctuations in estrogen levels throughout a woman's life, particularly during menstruation, pregnancy, and menopause, can trigger migraines. Many women experience menstrual migraines, which occur in the days leading up to or during their periods. These migraines are thought to be triggered by the drop in estrogen levels that occurs before menstruation. Hormonal contraceptives can also influence migraine patterns in some women. Pregnancy can bring about changes in migraine patterns. Some women experience an improvement in their migraines during pregnancy, while others find that their migraines worsen. Hormonal changes during pregnancy, particularly in the first trimester, can influence migraine frequency and severity. Menopause, another time of significant hormonal change, can also impact migraines. While some women experience a decrease in migraine frequency after menopause, others find that their migraines persist or even worsen. Understanding the link between female hormones and migraines is crucial for tailoring treatment plans to individual needs. Section 9. Finding relief. Tips for managing migraines. Living with migraines can be challenging, but several strategies can provide relief and improve quality of life. While medication plays a crucial role in managing migraines, lifestyle modifications and alternative therapies can also be beneficial. One of the most effective ways to find relief during a migraine attack is to identify and avoid triggers. This might involve making dietary changes, managing stress levels, getting enough sleep, and staying hydrated. Creating a calm and quiet environment during a migraine attack can also be helpful. Applying a cold compress or ice pack to the forehead or back of the neck can help numb the pain. Over-the-counter pain relievers like ibuprofen or paracetamol can also provide relief for some individuals. Resting in a dark, quiet room can minimize sensory stimulation and promote relaxation. Alternative therapies like acupuncture, massage, and biofeedback have shown promise in reducing migraine frequency and severity. Maintaining a headache diary to track triggers, symptoms, and medication use can be immensely helpful in managing migraines effectively.